Hi everyone, my name is Dr. Nicoleau. I've been a physician now for more than 25 years, so I've treated a lot of conditions. I'm board certified in internal medicine and sleep medicine. I'd like to just spend about 5 minutes today talking to you about two very important medical issues. The first is the importance of evaluating for silent cardiac conditions, and the second one is also to talk about obstructive sleep apnea. Now, I understand that you are medical professionals, you're nurses, so we're not going to talk about basic issues. Generally, it's pretty easy to know when somebody's having an acute cardiac event. The challenge really is to identify patients who are at increased risk but are asymptomatic. As we know, there are a lot of patients who their first sign of silent heart disease, they'll just drop dead. Okay? So, who is at risk for cardiovascular disease? Obviously, the patient's family history, personal history, people who have diabetes, hypertension, smokers, people who are sedentary, and people who are obese. Now, we know that the final pathway is complete obstruction of an artery, either in the brain or the heart, which ends up in death or severe incapacitation. So, we have often found patients who are at high risk and yet don't know about it. There are some basic cardiovascular tests that can be done on a mobile basis where we can actually look at the blood flow to the brain. We look at the blood flow through the carotid artery. We can actually look at the blood flow through the arms and legs. We can look for abdominal aortic aneurysms, and we can look at the blood flow to the kidneys. We can also do echocardiography, and I have to tell you, in my experience, we found a lot of patients who actually were at high risk for a stroke or heart attack, or even for a rupture of an abdominal aortic aneurysm who had no idea that they were at such risk. So everyone who has the risk factors that we talked about, certainly anyone above 50 should have periodic assessment to hopefully identify disease before it becomes fatal. Now, a mobile unit can be brought to the patient's home, and all of the studies that we've talked about can be done fairly quickly. The radiologist, the cardiologist will evaluate the results and expeditiously send the results to the referring physician, and any further assessment can follow. Now, I'd like to switch gear and talk to you about obstructive sleep apnea, which apparently very few people, laymen and doctors alike, know about. So the same risk factors for cardiovascular disease apply to obstructive sleep apnea. By definition, obstructive sleep apnea means that the person stops breathing for at least 10 seconds while sleeping, but of course most people will stop breathing for hundreds of times at night. Now, 80% of people who actually have sleep apnea are totally unaware of it. And I want you to know that obstructive sleep apnea is actually the next silent killer, because we know from our own sleep lab and from a review of the literature that people who have obstructive sleep apnea are at high risk of strokes, heart attack, diabetes, cancers, and now we're talking about Alzheimer's disease, especially in patients who are female and have diabetes. So how does one know if a patient should be screened for diabetes? Actually, not just diabetes, for obstructive sleep apnea. Anyone who has diabetes should be screened for obstructive sleep apnea. Any patient who requires 2 or more blood pressure medications should be evaluated for sleep apnea. Any male who has erectile dysfunction should be screened for sleep apnea. Anyone who snores, stops breathing, anyone who reports feeling fatigue or tired during the daytime, anyone who has depression should be screened. Now, there are some obvious physical characteristics, the so-called craniofacial findings. These are inherited anatomical clues that suggest that a patient may have sleep apnea. So the first is a small chin, a large neck in a woman, a neck 16 or more, in a man, a neck size of 17 or more inches, someone who has a large tongue, the so-called malampathy class 4. All of these patients should be evaluated for obstructive sleep apnea. Now, we do have the technology to bring a home sleep study to the patient's living, and the patient can have the sleep study, and the results can be forwarded later on to the patient's physicians for further assessment. Thank you very much for your time.